this is the average score, this is the median, and this is the range of scores that you guys are scoring in this IHBAS Mphil clinical psychology free mock test that happened yesterday. First of all, before we start, try to identify which type of curve this is. Is it a positive skew, is it a negative skew, or is it a proper NPC curve? Okay, so as you can see over here, this average is 90. Okay, so all of you are scoring on an average side. 90 is the minimum average which you need to score for the upcoming IHBAS examination. Okay, nearly 17 days are left for your IHBAS examination, and you need to do this mock test. So if you have not yet attempted this mock test and try to analyze your score, where you are standing, okay, and the highest score so far received is 98. Okay, so if people are scoring 98 over here, approximately they will score around 95, 96, 97, 98 in the real time examination as well, because these questions are going to jump up in your 28th of September examination date. Okay, so you have to practice, practice, practice. The more basic, the more easy to moderate questions you can do, that will be helpful for you. Okay, you have to focus to the complete syllabus or of IHBAS, IHBAS clinical psychology. Do the general psychology portion, do the research portion, and all those things are very very important for you. Okay, so this was the first mock test. Please wait, the second mock test is also loading up, so make sure that you give that mock test as well. If you don't know how to get this mock test, just simply join the Telegram channel and follow all the updates completely free of cost. Okay, you don't need to do anything, you don't need to pay anything to attempt these mock tests, that these are completely free. And what you need to do is you need to do the revision. Okay, revision of these four books. This is for your clinical general psychology, this will suffice for your research portion, these two will suffice for your clinical psychology portion. Okay, because your 40% syllabus is from where, 40% syllabus is from your clinical and abnormal psychology. Now if you have access to these mock test series, of course this is a paid series, so if you have access, make sure that you practice all these questions. The PDFs are also getting updated in this thing, so make sure that you revise properly whatever is there. Okay, each and every 7,000 question you need to remember very well. Okay, and those who still not have access, you can just mail us on the description, pay your fees, and then you can have access to these complete 7,000 questions which are going to come in IHBAS 2025. Okay, it has happened previously also. Questions from here only have been appeared, or they are appearing in 2024, and guaranteed 100% questions will be coming in 2025 as well. Okay, once the paper is out, I will also show you. See, this question from this C series, this is from the updated series, this is from the PYQ mock and all those things. Okay, this is very very necessary, it is very very tre aapke liye, I mean this is very very important for you. Okay, very very important for you to do the PYQs, this mock series. Attempt, people are attempting 10 times these questions, so you have to also do the same thing. You have to just revise, 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 and do the basic stuff. Okay, let's quickly have a look at the syllabus. Okay, see this portion, this is very very important, and this is the only portion where you will lose most of your marks. Okay, because over there 1 2 3 odd questions will be there which you might not be able to do. Let's suppose the question is coming from the Capgras syndrome, or it is coming from the Korsakoff syndromes, or is it coming from any of these syndromes, it is coming from cognitive distortions, or is it coming from some psychopathology and all those things. Now this 40% is the major portion. Okay, 40 marks you have to score from here only. So this is the most prioritize and the most important thing which you need to do. And for that, what you will do, you will read the N book and the F book, and you have access to this NF mock test series. Okay, so you will do questions from there only. Whatever those questions are there, you have to do, and questions will come directly in your exam of 2025. Okay, the point over here is you have to be more accurate. Okay, and I have seen changes in people scoring 80 earlier, and now their score is jumped to 94, 96, 98, and things like that. Why this happened? Because of the proper book reading, proper mock test attempts, and multiple number of attempts. Okay, and to clear the examination you have to be more accurate. Just now you saw the average score is 90, average score is 90, everybody is scoring around 85 to 98. Okay, this is the most common range. Okay, out of those 60-70 people, 60 people are scoring in this particular range, and those who are newbies or starting for the very first time, their score is something like 65, 70, 80, like things like that. Okay, but you are not a newbie right now, you have to clear the examination, so you have to focus on the revision of proper things. Okay, Just do these 4 books and the 7,000 bundle, and that is it. Okay, and you will be given how many times, I'm not how many times, you will be given what time, not what time, but you will be given 90 minutes of time, half an hour, okay, 1.5 hours, and in this 90 minute you have to attempt 100 questions. Okay, not even 2 plus 2 becomes very very difficult. Is it 4, is it 5, or is it 2 2? Okay, this happens in real examination. You might wonder, okay, 2 plus 2, this is an easy question, but remember this thing, that even if you know question answers today, but in the examination hall it is guaranteed that you will miss on the slightest thing. Okay, if I give you that question, you will answer that question correctly over here. That is why examination, main purpose of examination is what, how you are going to perform in the pressure situation. Okay, and it is already proven, you have studied this thing in n number of times. The more you practice the same things, the more accurate you will be in that particular thing, and the more high score you can score in that particular examination. Okay, now what I was telling, even the easiest question will seem very very difficult, or it will just go out of your mind that what is going to be the correct answer. Okay, for example, the difference between hallucination and delusion, you might forget this thing. If I give you one word, you will be able to not able to answer that properly. Along with that, sensory adaptation and habituation, these are almost similar phenomena, but there is some slight difference. Okay, between these two, sensory adaptation and habituation, there is slight difference between these two. And in the examination hall, if you have not remembered this thing, if you have not read about this thing, if you don't know what is the difference, what is the basic difference between this thing, you might get confused. Okay, between social loafing and bystander effect, there is always a thin line in between these two topics, almost same but somewhat different. Or let's say bystander effect or diffusion of responsibility. Okay, what is going to happen between these two things also. Okay, these are topics from the social psychology, and my dear, you have to answer social psychology for 10 marks. There will be definite questions on social psychology. Conformity, compliance, obedience, you have to be on your toes for this particular topic. Who has given what? Muzaffar Sharif, Roberts cave experiment, very very IMP. Social exchange theory, whatever theories are there in social psychology, just do this much and you will be able to answer those questions correctly. Okay, and questions will be coming from here only. The C book will, if you do only C book, I am not telling you to go and read Baron for social psychology completely. Okay, they are not going to ask for that. This is not a UG Senate or a gate or whatever examination. Okay, this is a simple basic 90 minutes time period, 100 questions, simple side examination. They are going to ask you about diffusion of responsibility, they are going to ask you about bystander effect, and they are going to ask about these simple concepts and topics. Okay, they can even ask you about the compliance, the lure effect, or not lure effect exactly, this will get difficult, but the simple, that's not all in all these things, because they have mentioned over here. Okay, it is not like that. The social psychology, the complete chapter, you need to remember what is happening over there, and out of that chapter only 10 questions are going to come from there. Okay, they have mentioned explicitly that we are going to ask about social psychology as well, so why you will not read. Okay, physiological psychology, chapter number 3rd 4 becomes important for you, 10 marks again over there. Developmental psychology, see, they can even ask you about zygote, or they can ask you about the OAPLG, psychosexual development stages, or they can ask you the moral development, they can ask about the anything related to your developmental psychology. Okay, they can even ask you about development of language, about Vygotsky, ZPD, or John Piaget, those stages. These are going to come definitely. Okay, without that, MPhil paper is not being set to the standard of IHBAS examination. Okay, then next about personality. Personality also becomes important. If you have a reference to NCRT, make sure that you read the NCRT chapter as well. Okay, they are going to ask you about RB Cattell, or they are going to ask you about what that propium thing, Alport, and all those things. Personality theories also becomes very very important for you. They can also link Trigona theory and all those with your personality, the body trait and type. So this is mentioned right in front of you. What you need to do is you need to have more accuracy in that particular thing. In statistics and research methodology, one question is definitely going to be the parametric and non-parametric thing, one question on interval ratio and all those things. So you already know beforehand what is going to come. What you need to do is just revise those topics and practice. I have told you from where to read all these topics, so you have to be very very cautious. Okay, they are not going to waste their time looking for 15-20 random books and asking questions from there. They will just visit CANF simple, they will take a simple topics and they will ask questions from there only. Okay, So just do the basic math, just do the basic stuff. If you have access to the bundle, make sure that you do questions from there, the free mocks as well, and practice more of these questions. Okay, even 100 out of 100 questions might be coming from this complete CNF 7000 bundle. It can also happen, or it can happen also with these books. Okay, Capgras syndrome. If you don't know right now what is Capgras syndrome, as soon as I say Capgras syndrome, you have to be aware, you have to answer without looking even to the options. Okay, this is how you can be more accurate with your preparation, and your chances will increase the more you do things. Okay, Capgras syndrome, Othello syndrome, and things like that, you need to have proper knowledge about all these topics. Now see over here, this is question number 63, schizophrenia. You have to read this thing. Question is going to come directly on schizophrenia, maybe persecution, delusion of reference, grandeur, whatever that is. Now see option number B, Korsakoff syndrome. It is mentioned clearly in N book, in F book, in C book, every general psychology book you will have this particular thing. Okay, so you have to prepare according to the demand of that particular examination. And what is IHBAS demanding? Do only these books, nothing else. Okay, Huntington's disease is also given, multiple sclerosis is also given. So now for next time, what you need to understand is, you know about this, you know about this, but what about this multiple sclerosis? What are its types? Is it a, okay, tell me in comment section in answer, is it a neurodevelopmental disease? Is it a neurodegenerational disease, or is it a autoimmune disease? Okay, answer without googling. Okay, if you know the answer, you are doing good. If not, you have to do proper and thorough revision. And for that, what you have the mock series, you have the questions, you have the books. Read, and it is very very important. In Erickson's theory, which conflict characterizes late adulthood? This question also is only from those books. See what simple questions they are asking. What is the main difference between classical and operant conditioning? You have to answer only the basic stuff. This is your general psychology portion. I mean, not general psychology, this is your general master's PG level question. Generalized anxiety disorder is a pervasive condition, difficulty in seeing objects. You can also see, you will get this confabulation, all these things in the N book and F book. Okay, N and F mock series becomes very very important for you if you are going, because 40%, can you imagine, 40 questions are going to come from here only, and you have to be accurate. See, you will be able to answer after the examination hall, but that is not the total point. Scoring 85, 86, 87, 88, 89, 90 is never going to help you. Scoring 95, 96, 97, 98, it will increase your chances. Okay, because person sitting next to you might be scoring 90, 95, 96, and you are just wondering 85, I was just inches away. No, you are not inches away, you are far away. Okay, make sure, because it has been happening with people that they are scoring 85, 86, 87, thinking that they know, they don't know. You have to be more and more accurate until and unless you memorize all those things and you revise thoroughly for all these topics. Which term refers to the consistency of a measure? Right now this question seems very easy, but in the examination hall you might get confused between what is happening in that particular thing. Okay, the term anterograde amnesia. See the basic question. They can even ask about infantile amnesia. If you don't know infantile amnesia what it is, go read book, you will find answer. Okay, I'm not telling you to read 20 different books. I'm just telling you whatever I am asking, whatever IHBAS is asking, whatever any examination in India happening right now is asking, only from these four major books. 90% to 95% is coming from here only. You have to be very very precise and accurate. That is what the whole point is. Okay, the term anterograde amnesia, you will find these type of questions in the examination hall. This time they can ask you about retrograde amnesia or what not amnesia. Okay, in operant conditioning you have to be thorough. What happens in extinction, what is happening in shaping, what is successive approximation, and what is a defining feature of somatic symptom, and see bystander effect. For next time, read group polarization, what is cognitive dissonance, social loafing. Only read this will suffice for your 10 marks. Okay, social psychology will be very very easy. You can't score 100 out of 100, but if you divide your syllabus like this, social psychology, I will practice the questions and I will mark this and like that, so you will be able to answer questions properly, and the chances of missing the complete examination or scoring below 90 will be phased out. Okay, so if you revise and if you practice like this, so it will be helpful for you to clearing the upcoming IHBAS 2025 examination. Okay, and you can see what is the main purpose of using meta analysis, and this question was also in the pre-mock test happened yesterday about meta-analysis. So this has been designed to make you clear IHBAS 2025 examination, and depending upon the pattern, all these mock series are prepared, whether free or paid, whatever that scenario is. And now we will move towards where we will learn something. If you are watching this video, make sure you might have learned or you might know this thing, but let's try to revise what is happening with your sensory habituation and sensory adaptation. Okay, for that, where we will jump to over here, what you can see is habituation. Okay, what is habituation? Make sure that you are aware, alert, and the basic difference you will understand today. Tendency of what? Of the brain. What is brain? You know what is brain. Okay, to stop attending to constant or unchanging information. Tendency of your brain, which is having the cerebral cortex, the frontal lobe, parietal lobe, occipital lobe, and temporal lobe, where all the information from your world is going. Okay, but what type of information that is? That is your unchanging information or the constant information. Okay, unchanging and constant information, the stimulus, it will stop. Who will stop? The brain will stop. Okay, this you have to associate with the habituation. Okay, so let's suppose you are sitting over here and you are watching this particular video. Okay, you are watching this video and you are sitting, and there is this ceiling fan that is rotating at a rpm of 100 watt or 100 rpm. Okay, now it is rotating. So you are indulged in this particular video, and suddenly what happens? The power, the load shedding cuts down and the power is off now. Okay, and now suddenly you will go towards, your attention will go towards, okay, the light is gone, it is a time for load shedding period and all those things. So you will remember, but whether or not you are paying attention to this particular stimulus, no, you were not at all paying attention. Okay, you were not at all paying attention. Where you are paying your attention? Towards this particular video of a dancing girl. Why? Because your brain stopped giving, or it stopped what? It stopped attending to the constant and unchanging information. The information of this rotating fan was not at all changing, it was rotating at 100 rpm. Okay, but suddenly as the power goes cut off, as the power goes off, now the rpm becomes 0, and suddenly now the information is changed, and your brain will attend to that. Okay, it will happen to anything. So what is the main keyword? Main keyword is your brain over here. So your brain will stop attending to the information. Who is stopping? Your brain is stopping. Not your hand, not your toes, not your feet, not your hairs, not your nails. What is stopping? Your brain is stopping. Now, if you are born in India, then 99.9% of you would have used this particular pencil. Okay, this can be blue, red, or depending upon your geographical condition, but you would have definitely seen 100% this HB pencil. Okay, HB pencil or Apsara pencil or Nataraj pencil, whatever, depending, you would have seen depending upon your geographical condition. Okay, now what is the benefit of this HB pencil is, you will now remember for your lifetime that habituation will stop doing what? For your brain. Okay, I hope this helps. If not, it's completely okay. So I hope many of you will remember the HB pencil. Habituation will make your brain stop towards the unchanging information. Okay, not towards the changing information. Now what is next? Okay, this HB, now this is something very interesting going to come. Just do the IHB and AS. Okay, and now see, this is called improvisation. What is this AS? This is for your sensory adaptation. Okay, so this was just an improvisation. Okay, now we will look into what it is, our sensory adaptation. Okay, what is sensory adaptation? Tendency of sensory receptor cells to become less responsive to a stimulus that is unchanging. So what is the common thing? If they can ask you what is the common between sensory adaptation and habituation, the information is always unchanging in both the cases, in HB also and in this SA also. Both the thing, similarity is what? The stimulus is unchanging. Okay, but now tendency of what? Is it your brain? No, it's your sensory receptor cells. Tendency of what? Tendency of your sensory receptor cells to become less responsive to a stimulus that is unchanging. So that is why the very first time you will eat dairy milk or 5 star or Kit Kat or Milky Bar or whatnot, whatever you will eat, or whatever sweet you will eat, maybe it can be anything ranging from whatnot. The first time you will eat, or maybe it can be pizza or something like that, the very first time it is very tasty, then the taste goes down, then little down, and then it is okay. Okay, the very first taste of pizza, the very first taste of chocolate or the ice cream or whatever thing is, it is so tasty, so wonderful. But the next time you want the next bite, third bite, fourth bite, the thing is not that good as you tasted it for the first time. Okay, so why it is happening? Because of the umami, the tongue. Your tongue is doing what? She is doing the sensory adaptation. Okay, your tongue is doing the sensory adaptation. Why? Because the pizza flavor is not changing, it is the same corn or whatever that fresh pan pizza is available, the taste is unchanging. Now the stimulus is constant again, the stimulus is constant to your tongue, and this will stop. Okay, in this condition, the tongue, the sensory receptor cells, the papillae is stopping to send information further or whatnot, but your brain is working properly. Okay, brain is not stopping. When brain will stop, it will stop in the habituation phase. And now, where are sensory receptor cells located? And one thing is important, each and every single particular sense is prone to sensory adaptation. It is nothing like that, that your nose will not fall for this, or your tongue will not fall for this, or eyes or ears or touch. You are always prone to the sensory adaptation. Okay, and what type of sensory receptor cells you know? You know about cochlea, you know about rods and cones, you know about the papillae, you know about the olfactory bulbs. These are what? These are all your sensory receptors cells. For more information, refer to the book for more detailed analysis and this all thing. Okay, so I hope you got the distinction between the, this is your sensory adaptation, this is your habituation, and this is your IHBAS 2025 examination. So wish you all the very best. If you have not yet joined on the Telegram channel, make sure that you join over there. And if you have not performed the free mock test series, it is only for the limited time. Make sure that you attempt that free mock. If you want to have the paid version, take the complete CNF 7000 bundle and practice more and more, so that all the best.